moment, let's navigate to the caseload breakdown by diagnosis. Here we're looking at it, one of our most powerful clinical management tools. What's unique about this visualization is that it doesn't just show you raw diagnosis counts. Our AI algorithm analyzes your entire caseload to calculate what we call a diversity index, a numeric score that quantifies how specialized or diverse your practice is. Here's the score right here. Notice how the system automatically identifies that this practice is moderately diverse with a balanced approach between specialization and diversity. It identifies there's an ability to serve diverse client needs effectively. This score is calculated using a proprietary algorithm that considers both the number of different diagnoses you treat and their concentration pattern within your caseload. So there's a score of 17.2 or 7.2 rather. The diversity index score is 7.2. It's always out of 10. And as you can see, this number, it feels right. So bipolar 2 disorder, 14 clients with that diagnosis, PTSD 7, and a lot in the middle here. We get the increased information if you hover the mouse over the specific bar. And this is a moderately diverse practice. There is no concentration, there is no high concentration of one specific diagnosis comparably, but also it's it could be more diverse. And so the machine learning algorithm on the back end has come up with a score of 7.2. And you can see how if you are analyzing a supervisee's caseload, for example, and you're using this numerical score to gain insight into their caseload, this could help with referral purposes. It could help identify which areas of training that specific clinician may need. For example, if they have many clients with trauma on their caseload, or if their caseload is more mood disorder heavy. It's those sorts of insights that these analytics and this visualization helps with. So yes, this is particularly valuable in supervision contexts, rather than just seeing that a therapist has 20 clients with depression and 5 with anxiety, for example. The supervisor gets an objective measure of clinical concentration that informs training and referral decisions. The AI doesn't stop at analysis. It generates specific recommendations based on your practice profile. For a specialized practice, you'll receive targeted marketing strategies for deepening your niche. For a diverse practice, you'll see recommendations for managing clinical breadth efficiently. And it's going to provide clinical strategies based on the top diagnoses in your caseload. Obviously, clinicians who use this platform should recognize that it's a decision support system and the recommendations it presides are not to it the recommendations it prescribes are not meant to be looked at as facts or to be taken with an all or nothing approach or what have you. Instead, each clinician needs to use their professional judgment and make their own determinations. But you can see how this provides a helpful organizational blueprint for the bipolar 2 disorder, which is the highest diagnosis count in this specific data set. It's providing evidence-based treatments. It's providing key assessment tools. treatment planning focus. And it does this for all of the unique diagnoses specific to your caseload. The system automatically links your top diagnoses to validated treatment approaches, creating a bridge between your actual caseload and best practice guidelines. This is the kind of intelligent, actionable insight that transforms raw practice data into strategic advantage, whether you're supervising clinicians or optimizing your own practice. Instead of looking through your EMR and navigating to each client's page specifically in a time-consuming way, you get a bird's eye view. Here are all the diagnoses on your caseload. Here's the concentration level with specific insights tailored to your unique situation. And as usual, click on download the professional report. Here it is.